Hello there, you are tuning into Good Morning Malaysia with me, Haizat Yama. Main headline. A shocking outbreak was reported in our country affecting people around Selangor, Wilayah Persekutuan Kuala Lumpur, Johor, Melaka and Pahang. This outbreak was classified as anemia disease and had affected a total of 1,064 people within the 5 states since the first case reported. According to the Ministry of Health Malaysia, anemia is defined as a condition with low amount of red blood cells in the body below the normal range together with low level of hemoglobin. In normal condition, a man would roughly have 4.7 to 6.1 millions of red blood cells per microliter of blood, while in women, there are about 4.2 to 5.4 millions of cells per microliter of blood. Some anemia are considered as the disease itself, while the others may be a clinical symptoms of underlying primary diseases. The ministry also added that some anemia are associated with abnormal morphology of red blood cells. Normally, red blood cells appear as biconcave disc shape with a diameter of 7 to 8 microns. The cells are also containing central pallor located in the middle of the cell with approximately 1/3 measurements of the cell. A press conference was conducted by the Ministry of Health yesterday to enlighten the outbreak issues in our country. According to the Director General of Health, the production of red blood cells in human body are regulated by a hormone called erythropoietin, which is produced by tubular cells in the kidney. This hormone will then travel to blood cells producing organ, our bone marrow, to stimulate the process of red blood cell formation, erythropoiesis. The tubular cells are stimulated by the oxygen level in the blood. Erythropoietin will be highly stimulated in low oxygen condition to induce high production of red blood cells to compensate the condition. It is known that there are several other organs that produce erythropoietin, including the brain and uterus. To know more on the details of the disease, we are connected live with our sub-journalist, Alia Nazira, to present her findings regarding the etiology and several types of anemia.
Good afternoon. My name is Alia Nazira and I'm reporting from Shah Alam, specifically from Kampung Lama, where the first cluster of anemia was discovered. As this disease has been spreading all over Malaysia, this location has been declared as the most affected area. Based on my observation here, majority of the residents have already exhibited at least one symptom of anemia. For those who are in the dark, anemia can be caused by several factors. Among them are when a person suffering from heavy and prolonged bleeding, such as GIT bleeding, or when the body fails to fulfill high demand of RBC, especially during pregnancy phase. Other than that, anemia can also be caused by hemolysis or due to decreased RBC production that can happen when the body has low level of iron or hemoglobin. These varieties of etiology can lead to different types of anemia, as for example, pernicious anemia, G6PD anemia, sickle cell anemia, aplastic anemia, and thalassemia. For more information, we brought to you an interview with residents here that have family members that are already affected with this disease. I, Alan Azura, reporting from Kampung Lama.
I'm Akila, working as a personal shopper. Recently, one of my family members has been showing an obvious symptom of having anemia, which was very terrifying to be witnessed by me and my other family members. We have been very clueless on what actually happened to her. Every day she will show fatigue and weakness symptom in which it never been seen before this. She has been an active and energetic previously. Also, her skin appeared to become more pale and having yellowish skin recently. Apart from that, she keep on complaining of having shortness of breath frequently, especially when conducting physical activities outdoor. Me and my other family members also noticed that she will having dizziness and lightheadedness most of the time these days. And the most worrying part, both of her hands and feet are very cold even in a hot and sunny weather. I sincerely hope that our government and the healthcare system of our country can quickly figure out about this disease in order to tackle this problem before it becomes worsened. Thank you very much.
Thank you, Alia. On to the latest update of the disease, we bring you live explanation on anemia from the National Hematology Laboratories, Dr. Siti Nurliana. Doctor, can you explain on the current update of anemia outbreak in our country and what is the pathogenesis of the disease?
Assalamualaikum and good day. I'm Dr. Liana from National Hematology Laboratory. For the current updates, anemia cases has reached more than 500 cases within these 2 weeks. The hospital and medical staff are all overwhelmed by this crisis. So what is its pathophysiology? Anemia is a condition when there is low level of red blood cell count and hemoglobin concentration. So the function of red blood cell is to carry oxygen from the lungs to every cell in the body in order to carry out body metabolism. It also will excrete out the carbon dioxide from the cell body. So the one that will bind to oxygen and carbon dioxide is hemoglobin that becomes the main component of red blood cell. So from here, we can see that the role of red blood cell is very important in order to prolong our life. But then, there are certain conditions that may disturb this normal physiology, such as decrease in red blood cell production due to kidney failure and bone marrow infection, blood loss, hemolysis, and lastly, due to increase in demand. The blood loss can happen because of many reasons, like giving birth, gastrointestinal bleeding, and prolonged menstruation. Meanwhile, hemolysis here means that there is defect on the gene and body that cause the red blood cell to break down, such as thalassemia. All of these things will reduce the amount of red blood cell in the body and lead to the symptoms such as fatigue, dizziness, and pain. All of these are happening as there is no enough oxygen to support body metabolism. So this is basically how anemia can happen. My, my short message is please beware of this condition. Our daily lifestyle depends on it.
Thank you, Dr. Siti Nurliana. As our country are still fighting to contain this anemia outbreak, few other countries around the globe had successfully controlled the disease. And now we are glad to have Professor Wang Yuming from China to present on the investigation and treatment strategies by their government to fight against the disease. Please welcome.
Hello there, my name is Professor Wang Zhongxing, a representative from China Ministry of Health. As of today, I am honored to share with your country about our approach concerning the outbreak of anemia. As the masses know, China is one of the countries that reported a high number of cases during the early phase of the outbreak. Luckily, with our fast responses and quick approach, the consequences and fatality rate managed to be mitigated greatly. With this session, we humbly hope that this information can help your countries in resolving anemia outbreak in your area. So, in diagnosing the patient infected with anemia, we decided that complete blood count is the best investigation method. By conducting the test, we managed to observe red blood cell, white blood cell, platelet, hemoglobin, and the hematocrit count of the patient. Usually, patients with anemia will have low red blood cell, hemoglobin, and hematocrit count, with normal white blood cell and platelet count. Other than that, reticulocyte count is also useful in diagnosing this disease. Usually, high reticulocyte count means that erythropoiesis process is happening rapidly, while low reticulocyte count means that the bone marrow of the patient is problematic. Other tests that can be conducted include peripheral blood film that is used to observe the morphology of the red blood cell, whether it is concave in shape or disfigured, as well as measurement of serum iron, and bilirubin. As for treating the patient with anemia, experts from my country decided that the best approach to eradicate this problem is by solving the root causes. The best treatment and management plan for this disorder is by treating the underlying disease that resulted in anemia. As our example, if the patient experienced severe blood loss, the patient must be given blood transfusion to replenish the deficiency immediately. And if the situation is critical, treatment will oral iron such as ferrous salt and ascorbic acid. The vitamin C that is essential in iron metabolism should be administered. Other than that, parenteral iron can also be administered to that anemia that occurred due to GIT problem. It will yield faster result compared to oral iron, since the iron administered does not pass through intestine and instead injected directly to the blood vessel. Example of parenteral iron are iron dextran and iron polysaccharide. In order to manage the iron deficiency problem, dietary intake must be improved. The patient who suffered from anemia should eat food rich in iron such as red meats, nuts, greens, and green vegetables. Iron supplements also can be taken, but it is not advised to be used as main source of iron. That is the approach that we took to restrict and limit the spreading of anemia. I hope this information can be of help to you, especially in controlling the number of the anemia cases in your country. That's all from me. Thank you.
And that's all the time we have for this edition of Good Morning Malaysia. Stay safe and beware of anemia. I am Haizat Yama. Thank you for tuning in.